Nancy Cordes is our CBS News congressional correspondent. And Nancy, there is no time for rest. They're working through the weekend. What's up?
Well, you know, Bill, that things have to be really serious when Congress works on the weekend. And in this case, it's because the Democrats, who are going to be losing control of the House in just a couple of weeks, are desperately trying to pass these last few priorities before they simply don't have the votes to do it anymore. So they passed Don't Ask, Don't Tell in the Senate, the repeal over the weekend. That was big news for Democrats. Now they're trying to pass the START treaty, and we could talk a little bit about that and where they think the votes stand on that right now. And then they're also trying to get to a bill to give 9/11 responders who have health problems a little bit of extra money to help pay for their medical bills.
Well, Nancy, that revised 9/11 health care bill introduced by New York Senator Kirsten Gillibrand and Charles Schumer. And you spoke earlier with Senator Gillibrand, right?
That's right. And I started by asking her if she thought that she now had the votes, because as of just a couple of weeks ago, there were a lot of Republicans who had a big problem with the way that they were paying for this bill. Take a listen.
I think we have the votes, and we've been working really hard over the last few months with our Republican colleagues to make sure we could put this bill in a place where they could vote for it. That's why we've changed the total amount. It's why we've changed how we're going to pay for the bill. But I think the combination of those two things, we really have a good number who will support this bill. And as you know, this is about the first responders. This is about the men and women who ran up those towers when people were coming down, who stayed there days and weeks afterwards to first find survivors and then find remains and then do the cleanup. So the least we can do is stand by them now, and they desperately need this health care because they're literally dying of these diseases that were caused by the toxins that were released when the towers fell.
You've dropped the price of your bill recently from $7.4 billion to $6.2 billion. What would all these billions be used for?
Well, one of the reasons we were able to drop the price was because we recently had a court settlement where a lot of these first responders were paid out through a lawsuit for the costs that they suffered. And so because we got money there, we were able to offset it a bit and reduce the size of our bill.
And what do you do with the money? Do you just give it out in lump sums?
No, the money is specifically for health care and costs for people who die. So for example, if you have a first responder, the first thing that pays out is if there's any settlement, so that's done. The second thing is any health insurance that they have pays first, any workman's comp they have is paid second, and then if their health care bills still aren't covered, this comes in and pays for the rest of it. So when the Congressional Budget Office scored it, they just had to assume that everyone gets sick and is alive for a long time, so they had to score the highest number possible. So I don't think we're going to even use all this money at the end of the day, but that's how it gets scored. That's how we do business here. And so what we now have will be in place is a fund that pays for the health care for these first responders, for these heroes, should they need it, should their insurance run out, should their workman's comp run out. And that's what really makes a difference. And also included are the families that live exactly at ground zero, because a lot of those children, you know how children are more susceptible? Those toxins really affected them, the kids in daycare, the kids that were going to school right at ground zero, and a lot of them are getting these terrible lung disorders and asthma. So we want to make sure they have health care they need as well.
How do you determine whose illness is related to 9/11 and whose isn't?
They've already made those determinations. So in fact, this is a fund that's capped. The number of people who are eligible is determined. They know exactly who worked at ground zero, exactly who's eligible, and they've identified 22 diseases that they know are caused by the toxins that were released from the 9/11 towers crashing. And so they know what diseases to look for, they know who's eligible, and so this is a capped fund.
The argument that you hear from critics is everyone, of course, cares about the first responders to 9/11, but there are so many people who could use extra money, who are suffering from all kinds of things.
These are our heroes. These are the men and women who were there on 9/11 protecting this country. They're the ones we said, please answer the call of duty, help these people, help do the cleanup. And our government told them that the air was safe, so they didn't wear any protective gear. They didn't wear the kind of protective gear that could have preserved their health and made sure they didn't get these diseases. And so now, after we've asked them to serve, asked them to answer the call, we have to stand by them to make sure their health care is covered. This is a terrorist attack on the United States. We are there for our veterans. When our veterans go into battle, we make sure when they come home, they have the health care they need. It's the same situation. When we ask these first responders to go into battle, to go work on that pile, do the cleanup, the least we can do is give them health care because of the diseases they've gotten because of the work we ask them to do.
And you have some pretty startling statistics about how many people are getting ill and the ages that they're dying.
It's awful. We had a display in the rotunda right here where we had 29 NYPD ID, police badges on display of the men and women who died since 9/11 because of these terrible diseases. And the worst fact about that display was that the average age of the men and women represented there was 46. So these are young men and women in their primes with young children at home, young widows, young spouses, and we've left them with nothing. So we have to be there to make sure we can compensate them and give them the money they need for the health care so they can survive. I mean, just plain old survive.
You're kind of in limbo right now because you're waiting to see what happens with the START treaty before they bring your bill to the floor. Are you going to be voting on Christmas Day?
We might be, but I think we're going to get a Christmas miracle. I think people of goodwill are going to come together. They're going to vote on this right after the START treaty, and we can do all three votes right away. We can do the vote on the motion to proceed. We can do the vote on the amendment to change this pay for, and then we could do final passage. And you could do it all right in a row.
Got it. Well, Senator Gillibrand, thank you so much for taking the time to talk to us about it today.
Thank you so much.